What to do? If you have a heart attack alone, current evidence. You're home alone. You feel an intense, deep pain, as if an invisible hand were squeezing your chest. You try to move, but your body won't respond. Your breathing becomes shallow. You think, it's probably just indigestion. It'll pass. That thought, that mistake, costs thousands of lives every year. I'm Manuel Granada, a specialist in critical care for adults and a master's degree holder in basic biomedical sciences. And in the next few minutes, I'm going to show you what to do if you have a heart attack and you're alone. According to the most recent guidelines from the American College of Cardiology and the American Heart Association, published in 2025. What you're going to learn today can keep you alive until professional help arrives. First, there's a mistake everyone makes. Every day, hundreds of people die because they wait too long. They think the pain will go away, that it's not that bad, or that it's just tiredness. I've seen this mistake time and time again in emergency rooms. Patients arrive late because they denied the symptoms or because they searched online for what to do instead of calling emergency services immediately. And I don't blame them. A heart attack doesn't always present itself like in the movies. Sometimes there isn't a sharp pain in the chest. Sometimes it's just a slight pressure, discomfort in the arm, dizziness, unexplained sweating, or jaw pain. I remember a patient, Luz Marina, who arrived saying, I thought it was a muscle spasm in my back, but it wasn't. It was her heart crying out for help. That's why the first thing I want you to understand is this. If you feel persistent pain or pressure in your chest that lasts more than 5 minutes, treat it as if it were a heart attack. You lose nothing if you make a mistake, but you can lose everything if you wait. You must suspect what's happening inside you. A heart attack occurs when an artery in the heart becomes blocked. This blockage prevents blood and oxygen from reaching the heart muscle. Every minute that passes without blood flow, heart cells die irreversibly. The 2025 guidelines are clear. Every 10 minutes of delay without treatment decreases the probability of survival by 15%. That's why the goal is to recognize and act within 5 minutes. 5 minutes that can change your life. 5 minutes that can decide if you'll ever hug your family again. While you hesitate, your heart fights. The coronary arteries try to clear a path. The body releases adrenaline. The heart rate accelerates. And the brain begins to lose oxygen. That's the moment you must take control. I'm going to share a clinical case. A few months ago, I cared for Julio, a 59-year-old man. He was at home, watching television, when he felt pressure in his chest. He thought it was gas. He drank some water. He walked around a bit, but the pain worsened. Then came the dizziness, the cold sweat, and finally, he collapsed. But Julio had watched an educational video a few weeks earlier. He remembered that he had to act, not wait. He dialed the emergency number, left the speakerphone on, and followed the instructions he was given while waiting for the ambulance. Thanks to that, he arrived at the hospital still conscious, and today he is still alive. When I visited him after his catheterization, he told me, "I didn't survive by luck. I survived because I was prepared." That sentence sums up everything I want you to achieve with this video. So what should you do if you're alone? After analyzing the 2025 guidelines, I'm sharing 5 essential steps for anyone who suspects they're having a heart attack while alone. They are 5 simple actions, but based on scientific evidence. Listen carefully and commit them to memory. Action 1. Recognize and accept the emergency. If you feel pain, pressure, or burning in your chest, accompanied by dizziness, weakness, cold sweats, or shortness of breath, assume it's a heart attack. Don't self-diagnose. Don't wait. Don't think, "I'll go to the doctor tomorrow." The most common mistake is minimizing the symptoms. The second is taking antacids or painkillers, believing they will relieve the pain. If you are alone, say out loud, "This could be a heart attack." That mental act breaks the denial and activates your survival instinct. Your priority is to buy time. Denial kills. Action saves lives. Remember, The heart doesn't wait. Action 2. Call emergency services immediately. Don't try to drive. Don't look for a neighbor. Don't send text messages. Call the emergency number and leave it on speakerphone. The 2025 guidelines indicate that an early call is the most important step in the entire chain of survival. Operators are trained to give you life support instructions while the ambulance is on its way. If your phone has voice access, just say, "Siri, call emergency services." And one more thing, don't hang up. Keep the line open even if you can't talk. The operator can track your location by GPS and guide you down to the last second. I've seen lives saved thanks to a timely call. I've seen others lost for waiting 5 more minutes. Action 3. Stay calm and adopt a safe position. While waiting for help, sit on the floor or in a low chair. Don't lie down completely, as this can make it difficult to breathe. Lean your back against a wall, relax your shoulders, and breathe slowly. Inhale through your nose for 4 seconds. Exhale through your mouth for 6 seconds. This breathing reduces the heart's oxygen demand and improves brain perfusion. If you feel severe pain or a sensation of faintness, prepare the space. Open the door, remove obstacles, leave your ID visible. Remember, every second counts, but sudden movements can accelerate the damage. In emergencies, I've seen people collapse because they tried to walk to the door. Don't do it. Stay where you are and conserve your energy. Action 4. If you have aspirin, use it correctly. One of the strongest recommendations in the 2025 guidelines is the early use of uncoded aspirin, 160-325 mmHg, or 300 mg of acetyl salicylic acid, only if you are not allergic and have no history of gastrointestinal bleeding or recent major surgery. Take 1 tablet. Chew it slowly before swallowing. Chewing speeds up absorption and helps reduce the formation of clots that block coronary arteries. This is not a substitute for medical treatment, but it can buy you valuable minutes while waiting for the ambulance. I remember the case of a 47-year-old woman. She followed this exact step while waiting for the paramedics. When she arrived at the hospital, the doctor on duty told me, "That chewed aspirin gave him the time we needed." Sometimes, such a simple gesture can be the difference between life and death. Action 5. If you lose consciousness, use self-compressions. This is the most difficult part, but also the most powerful. The 2025 guidelines recognize that a person alone can initiate self-compressions if they feel they are losing consciousness and still have partial control of their body. It's not easy, but it can be done. Place the heel of your right hand in the center of your chest, just between your nipples. With your other hand on top, press down firmly, about 100 to 120 times per minute, as if you were following the rhythm of the song "Stayin' Alive." If you can maintain that movement for even a few seconds, you help maintain blood flow to the brain and heart. I have seen documented cases where these compressions, although imperfect, maintained enough circulation until the defibrillator arrived. It's better to try than to fail. Don't give up. It's also important to know what not to do. Some things, even if they seem helpful, will worsen the situation. Don't drink water or eat anything. Don't try to induce a cough as a treatment. The 2025 guidelines no longer recommend forceful coughing to restart the heart because there is no solid evidence that it works outside of a controlled environment. Don't pound on your chest either. The so-called chest thump is only indicated for trained personnel and in cases of witnessed cardiac arrest under close monitoring. Your mission is not to be a hero. Your mission is to stay alive until the professionals arrive. When help arrives, don't downplay your symptoms. Describe everything clearly. When the pain started, what you were doing, what you felt first, if you took aspirin. This order helps the medical team identify the type of heart attack and decide whether to activate the catheterization protocol. And if you are with someone else, never ask them to drive you to the hospital. Guidelines indicate that more than 60% of pre-hospital deaths occur during transport in a private vehicle. Always wait for the ambulance. I hope you never have a heart attack, but if you want to prevent it, start today. I invite you to watch my other cardiovascular health videos. Heart attacks don't appear out of nowhere. They build up day by day with years of bad habits. The 2025 guidelines reinforce 4 pillars of prevention. 1. Blood pressure control. Keep it below 130/80 mmHg. 2. LDL cholesterol control, below 70 mg/dl if you have cardiovascular risk. 3. Regular exercise, at least 150 minutes of moderate aerobic activity per week, or 30 minutes daily, 5 days a week. 4. Heart-healthy diet, fruits, vegetables, fish, whole grains, less salt and trans fats. Watch my video about flavonoids and their protective effect. And one more thing, don't ignore the early signs. The body always, it warns you. Fatigue, palpitations, back or jaw pain, shortness of breath. Listen to it. The body's silence often comes when it's too late. Today, I don't want this video to leave you afraid. I want it to leave you prepared, because a heart attack doesn't give warning, but it does give opportunities to those who know how to recognize it. If you ever feel chest pain you don't understand, don't ignore it. Act, recognize the symptoms, call emergency services, chew an aspirin if you can, breathe, and wait for help in a safe position. If this knowledge can save a life, yours, your partner's, your father's or mother's, then sharing it is worth more than anything. Subscribe to the Adult Health Institute. Remember, the difference between life and death can be a minute, and today, you have the knowledge to make that minute yours. Knowledge that saves lives. Learn, share, and act.